The broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. I would like to take this time to welcome you to the third of our four-part CCDBG Moving Forward webinar series. I hope everyone is having a great day so far. My name is Nick Fusick. I am the Senior Government Affairs Advisor at Child Care Aware of America, and we may be joined by Michelle McCready, our Director of Policy today. I would just like to take the time to say this is one of my favorite days. I hope everybody got out and exercised their right to vote this morning or is planning on doing it tonight. And, you know, I would really like to make sure that we're covering the pieces in this webinar series that are really crucial to the work that's going on in the states as well as federally, especially as we are now 1 week away from Congress's return to session, which I will definitely go through a little bit more in this presentation. But the main focus and emphasis for this presentation will be about what S1086, CCDBG Reauthorization, means for quality set-aside and quality rating and improvement systems. So as you can imagine, if you've worked with those before, there's quite a few pieces. So this will have a lot of depth to it as far as, you know, what's in there, what can happen, what can't happen. So please, if you have any questions or comments or concerns throughout the entire presentation, there's a question box which can be found on your little toolbar. You just type it in there, and when we get to the end of the webinar, I'll try and answer as many as we can. So before we go into a little bit about what's going on, I do want to make a quick note that the CCDBG Moving Forward webinar series is designed to provide an introduction into the amended version of S1086, the Child Care and Development Block Grant Act of 2014, and what, if passed, those in the states will need to be made aware of. In addition to awaiting final passage of the bill by the Senate and the President's signature to become law, the Department of Health and Human Services will then be responsible for providing guidelines for implementation that could alter some of what's discussed during this series. So we want to make sure that, you know, you guys out there understand that we're trying to provide some background so that when stuff hopefully starts to move forward as far as implementation, if the bill passes, you guys can have those conversations in your states that are really leading you in the right direction and making this a much easier process for everyone involved. Also, I would like to note that all PowerPoint slides, links to recorded webinars, registration links will be made available shortly after the conclusion of the webinar at www.usa.childcareaware.org/webinars. As I mentioned on the last one, we tried to get the YouTube video as well as the slides from it up prior to the next webinar. So I would expect these up by Wednesday or Thursday at noon Eastern time. And if you've been looking for the slides and webinars or slides and YouTube video links from the last two, those are on that website as well. They've both recently been updated, so make sure to check them out. And one last note before we move on, Child Care Aware of America is unable to offer certificates for participation in this webinar series, even though we've done it in the past. We are just unable to at this time for this series. So before we get into it, I'd like to provide some background around, well, who is Child Care Aware of America? What do we do? Since 1987, Child Care Aware of America, formerly the National Association of Child Care Resource and Referral Agencies, has been working to improve the system of early learning for children by providing training, resources, and best practice standards to local and state CCNRs that support high-quality, accountable services. We have been promoting national policies and partnerships that facilitate universal access to high-quality child care. We've been collecting, analyzing, and reporting current child care data and research, including child care supply and demand trends. And we've been offering child care and parenting information and resources to families and connecting families to local child care resource and referral services. So as you can tell, this is something that is directly as part of our core values. It's been our top legislative priority, CCDBG reauthorization, and we want to make sure that if it does move forward, you know, that we're doing what we can to help everyone, you know, move forward the implementation of it. So a little bit about the child care landscape. We hear a lot about the patchwork of federal programs, but in reality, there are only a few components to the core early learning system. They reach children and families in different places, either at home or in organized programs. They meet different needs for families, child development plus parents' needs, and at different times in the child's life. Home visiting and early Head Start can begin before birth. Home visiting and child care can last from birth to after children begin school. So what you see is that it's not just child care in a vacuum by itself. It's not just Head Start in its own silo. All of these programs, including state-funded preschool, interact and mingle with each other, which is important about, well, how does child care fit into that picture? Nearly 15 million children of working parents are in some type of child care every week. On average, they spend 36 hours a week in care. At least 1 in 4 families piece together their children's care dates are placed in multiple arrangements. This means that, well, 1/4 of families either use, you know, nanny care, or they use child care, or they use Head Start, or they use grandparent care or neighbor care, or family friend and neighbor care, and, you know, try to piece together how they get through a week or a day. How can they get through that while staying to work? Additionally, almost 60% of the cost of child care is assumed by parents, spending more than 30% of their monthly budget on child care. That is more than rent, utilities, transportation, and food in all regions of the United States. And at this time, I want to make, you know, before we go in, we talked about the cost of child care a lot. And in the past few years, we've been releasing reports called Parents and the High Cost of Child Care, which we'll be doing again this year. Actually, 1 month from today, exactly December 4th, we'll be hosting a release of Parents and the High Cost of Care. So I want to make sure you guys, especially those who are interested in learning about solutions that we're proposing this year, it's going to be a really interesting report we have coming up. So a little bit more about the system. Well, you know, I talked about who uses it and how they use it, but what is the federal system? Is there a federal system? Can you really call it a system? So the Child Care and Development Block Grant Program is the federal grant program that provides child care assistance for families and funds child care quality initiatives. So it was originally signed into law in 1990, and it was last reauthorized in 1996 as part of welfare reform. At which point they combined all of the streams that went to families to provide similar services, including AFDC, Aid for Families with Dependent Children, into one, and has that become the Child Care and Development Block Grant Program. What's really important, and I'll get into this more in just a second, is states have great latitude and flexibility in how they implement the federal policies that are provided. And one thing that's definitely important to note is that under current law, CCDBG does not require a background check for child care providers. It does not contain a minimum training requirement. It does not require regular inspection, and does not have some very basic minimum protections for children. And like I said, I'll get into some of that more in just a second. So as I mentioned, CCDBG, the Child Care and Development Block Grant, was established in 1990 and then reformed in 1996 as part of welfare reform. About 1.5 million children and over 900,000 families received child care assistance monthly in fiscal year 2012. In fiscal year 2012, over 450,000 child care providers served children receiving those sources. So you can see that even though it's a relatively small program compared to the need of families who need child care out there, it does touch a lot of programs, a lot of providers, and a lot of families. Each of the 50 states, District in Columbia, and the Department of Defense have unique systems that they can set up. And states can use funding from a variety of sources to blend with CCDBG funds, including Race to the Top, Early Learning Challenge Grant funds, as well as Head Start and Early Head Start funds, and TANF funds as well. Some states have consolidated offices of early learning, while others use different agencies to administer funds and services, which means that it's really up to the states where they want to have their departments of, or the management and administration of this program, where they want it in their government. And lastly, states are provided flexibility to determine licensing standards for child care programs operating within their state. So what you see is a lot of different, systems, a lot of different policies, different ways of doing things. And, with CCDBG reauthorization, that isn't something that will necessarily change significantly. States will still have that flexibility as it is a block grant program. But what CCDBG reauthorization S1086 will do will provide some baseline measures to make sure that there's at least some very minimum consistency across states. So how is the child care system funded? I know this is a question that we get a lot. It's funded through all the funding streams are combined into what's called the Child Care and Development Fund, which is CCDBG, the Child Care and Development Block Grants, which is a discretionary funding, which means it has to be appropriated each year by Congress. And then there's the Child Care Entitlements to the states, which is the mandatory funding piece, which is on a more automatic basis and doesn't really need impacted each year. And then, of course, you can also add TANF transfers to CCDBG. So what happens is these funding streams are combined and consolidated at the state level and administered under CCDBG Act rules. So in fiscal year 2014, there's $2.36 billion in discretionary funding and $2.917 billion in mandatory child care funding. So around $5.2 billion federal dollars being doled out to states there. So what is the quality set-aside? Under current law, states must dedicate at least 4% of CCDBG funds to be used to improve the quality of child care. So that's more or less pretty direct from the 1996 bill. But what was added under current regulations? How do they expand on that under current regulations? So what they added was states have the flexibility in determining what activities these funds are used on, but are provided with a list of allowable quality improvement activities, including enhancing compliance with and enforcement of state and local licensing requirements, expanding or improving child care resource and referral agencies, programs, and services, making grants or loans to providers to assist in meeting child care standards, providing training and technical assistance to providers in health and safety, nutrition, child abuse detection and prevention, and care of children with special needs. And lastly, improving salaries and compensation for staff who provide child care services. So what you see is a very basic level of guidelines that currently are provided to states. So let's break it down into how this actually looks and how it actually works a little bit more in states. In fiscal year 2011, states spent approximately $1.2 billion, including target funds, of total federal and state expenditures on quality activities, which total is about approximately 12% of the national average. States vary significantly on how much was spent at or above the 4% mark that is set down under current law. Since it is under current law, no state can go under it, but some states do hover right around 4%, and some states go well beyond that. Some states, hit in the 20s and even beyond. So what we see is 5 states in that 4 to 7% range in fiscal year 2011. 8 to 10% had 14 states. 11 to 12% had 8 states, and 13+% had 25 states. The reason I wanted to make sure I highlighted this is because this will be important when I talk about what's happening with S1086 later on in this webinar. And it's important that to note that states have differing descriptions and definition of what constitutes a quality improvement activity. What this does is create significant variance in calculation of funds set aside under the quality reservation. So just because a state has in the past defined an activity as a quality activity, if S1086 does pass and is implemented, there is a possibility that that will no longer constitute, a quality improvement activity, and they'll have to make sure the funds are being spent in a different way that does align with the new marks. So before I move on into what's actually part of S1086, I want to make sure I cover what the current system is as far as, or what the current status of quality and rating improvement systems are across the country. So this is a great map from our friends at the QRIS network and at the Build initiative. It shows that approximately 39 states have already implemented some kind, or launched some kind of QRIS system, whereas some states are still either building it, planning it, or aren't actually allowed to do it by law. So what is a QRIS? Quality rating, QRIS stands for Quality Rating Improvement System, and it's a method to assess, improve, and communicate the level of quality in early care and education system. States are able to set up or design individualized systems. A lot of them have used examples or models from other states, but most states build their own. And because of this, you see, just as with the child care system and child care policy in every state varies, so do the quality rating improvement systems. One often and common description of QRIS systems is described as Yelp for quality early care and education system, or as Yelp for quality early care and education, as it provides families and providers with a somewhat easy to understand way of, well, what is quality, and do these programs rate on a scale of either 1 to 5, 1 star to 3 star, or whatever scale they prefer to use. And it allows families to be able to compare and contrast and see what's out there. So as I mentioned, states are at different phases of designing and or implementing a QRIS system. 39 states have already launched a statewide QRIS system, whereas only 3 states have launched or completed a pilot system. 2 states have launched a regional one. 5 states are in the planning process for a QRIS, and 1 state has prohibited the use of QRIS. And lastly, another thing that's important to remember is some states make participation in the QRIS system in their state a requirement for licensing and or public funding. So if you're in a state that does that, you may need to make sure you're at it. If you're a provider and you're in a state that does that and you are required to be licensed to receive federal funds, you would need to then participate in the QRIS system. And in some states, it's even embedded with regards to reimbursement rates. So there's a state that does it where you have to be a 3, 4, 5-star out of a 5-star system, even to begin to receive subsidies or be eligible for subsidy funding. So let's start with the bill and what's in it, and we can go from there. So the Child Care and Development Block Grant Act of 2013 was introduced June 3rd, 2013. And what was in it was really amazing because it was a bipartisan bill sponsored by Senator Barbara Mikulski from Maryland, Senator Richard Burr from North Carolina, Senator Tom Harkin from Iowa, and Senator Lamar Alexander from Tennessee. If you notice, or if you know these guys very well, you might know that they're not very similar people as far as philosophy goes. And they were able to come together and agree on a bill that really had some significant baseline changes that would really help to put in place some basic protections for children and families. So what happened was it was introduced in June. In September of 2013, it went through the Senate Health, Education, Labor, and Pensions Committee, and it passed out of that committee via voice vote. So everybody basically said, does everyone agree with this? Yep. And they sent it forward to the full Senate. In March of 2014, the Senate took up debate on S1086, and after adopting 18 amendments, passed it by a vote of 96-2, which was a very overwhelming sign of support and a very overwhelming sign that this was a very important bill that many people could agree on. And in March of 2014, after the Senate passed it, the House had a hearing on it, and in September of this year, just a little bit over 2 months ago now, or about 2 months ago now, the House and Senate leaders announced an amended version of S1086 that they both agreed on. And only a few days later, the House passed that out by voice vote, once again saying oh yeah, of course we agreed to this, let's send it back to the Senate for their approval. After some politics came into play in the Senate, it is scheduled for a vote in front of the full Senate on November 13th to start the process. So we're looking at this as one of the top and first pieces of legislative business when the Senate resumes session in a little over a week. So what's in it very basically? It would require states to conduct comprehensive background checks. So that would include state and federal fingerprint checks, an FBI name check, a check of the sex offender registry, and a check of the child abuse registry. It would require inspections of programs prior to licensing and an annual inspection of licensed programs. Another big piece, which was new in the amended version, was that it would require states to conduct an annual fire, health, and safety inspection of licensed exempt providers receiving funds. So prior to this, states had the flexibility to decide if they were exempting providers from licensing standards due to whatever reasons they wanted to. They had the flexibility to do that. So the most common definition was something around, say, faith-based providers. They could exempt them from all or pieces of state licensing requirements. But now, at the very least, all providers that receive federal funds would have to get at least a fire, health, and safety inspection, which would be determined and defined by the state for their program. Additionally, it would implement professional development standards as part of licensing, so it would require greater training and technical assistance. And this is something I'll get into in a few seconds here. It would raise the amount of funds set aside for quality improvement activities. It would raise the eligibility period for redetermination to 12 months. So some states have varying amounts. Some have it at 6 months, some had it at 12 months, some had it at 18. It would make sure that at the bare minimum, the redetermination period would be 12 months. And lastly, it would designate a national toll-free hotline and website for referrals, quality information, and consumer complaints. So obviously, this is a very short and high-level list of some of the great pieces in the bill. There's a lot more in it. It's a almost 90-page bill, and there's a bunch of great pieces in it. But I wanted to make sure I highlighted some of the major pieces, especially as they relate to what we are about to talk about. So I talked about the quality set-aside, what it is and how it works, where it's at currently. So I said currently it's required to be at 4%, at least 4%. In S1086, it would require at least 7% of funds in after the first full fiscal year after enactment to be dedicated to quality improvement activities. So it's raising it in the first full fiscal year after enactment. So what is that date, and how do you describe it? So, or how can you plan around that? So if the bill was to be passed by Congress, enactment would be starting whenever the President puts his signature on it and sends it off to the relative agency. So it would be one full fiscal year after whenever that happens. So if that happens in December, it would be the first full fiscal year after that, so it would be starting in October 1st of the following year. So it's a little bit off, but that just gives you some idea of the timing for it. So in the first and second full fiscal year after enactment, it would go up to 7%. In the third year, it would go up to at least 8% and stay the same for the fourth year. And in the fifth year, all states would have to be ensuring that they are dedicating 9% of total expenditures on quality improvement activities. But that wasn't all that was included about the quality set-aside. Funds reserved for the quality improvement activities targeted specifically for infants and toddlers added an additional 3% onto that starting by the end of the second full fiscal year after enactment. So when all is said and done, from the at the end of the second full year all the way through the fifth full year, there's an additional 3% of funds going to activities specifically for infant and toddlers, quality improvement activities. And another big piece, and I can go into this a little bit more later, is that it would require a certification by states beginning in fiscal year 16 and each fiscal year after, assurance that the state provides a report of statistics and a description of how funds were used in the state for preceding fiscal years, containing the amount of funds received, the activities carried out, and the measures of evaluations for state progress in improving quality. So currently, states get the funding, they define the quality set aside or how they use the funds in their own language, and most of the time that doesn't necessarily go anywhere beyond the state plans, or there's no measure of whether or not that's how they spent the funds. So this will at least provide, for the first time in the program's history, a very or more clear picture of how quality set-aside dollars are being used. It would ensure that states are setting aside the funds properly and at the correct levels, and it would make sure that there's actually an outcome-based evaluation of whether or not those funds are being used in the best way possible. So that's a big piece of it. So I wanted to actually take a little bit of a few minutes here and go through some of what does the bill itself say about the quality set-aside. So I pulled out the language from the section of the of S1086 to, at least piece through some of what's in there. I'm not going to read all of it, but what I want you to pay attention to is that it really wants activities provided directly through grants or contracts with local child care resource and referral agencies or other appropriate entities that are designed to improve the quality of child care services, increase parental options for, and access to high-quality child care, and is in alignment with a statewide assessment of the state needs to carry out such services and care provided in accordance with this subchapter. So what does that actually mean? It means that earlier in the bill, states must first conduct a needs assessment around what is the situation, what are the circumstances currently happening in their states as far as child care goes. Are there places where they're maybe not up to par, not only with federal standards, but with other state counterparts? Are there places that are farther ahead? Are there huge gaps in care available in supply and quality for certain populations? So it really, wants to make sure states are understanding what's going on in their state with child care. After that, it's making sure that states reserve some of what's there for, what the intent really is with this money, and it's to improve the quality of child care services and increase parental options for high-quality child care. And that's really what the baseline definition of what they mean by quality improvement activities is. They want to make sure that the activities carrying out are very straightforward, but they do still give states a decent amount of flexibility in what those activities are. So under S1086, it lists 10 allowable activities for use of the funds reserved for quality improvement activities. So in it, I've also included, that these funds should be used to carry out no fewer than one of the following activities that will improve the quality of child care services provided in the state. So as I said, there's 10 allowable activities, and I will break each one of these down a little bit more just to give you some, very brief understanding of what's in it. The 10 activities are training and professional development, early learning and development guidelines, tiered quality rating system, infant and toddler care supply and quality, establishing and expanding child care resource and referral systems in states, compliance with state requirements for inspection, monitoring, training, health and safety, and licensing standards, evaluations of quality and outcomes of care, national accreditation for high quality, supporting state or local efforts to develop or adopt high-quality program standards relating to health, mental health, nutrition, physical activity, and physical development, and carrying out other activities determined by the state that could improve the quality of child care, and which measurement of outcomes relating to improved provider preparedness, child safety, child well-being, or entry to kindergarten is possible. So you can see this is a very high-level kind of view of what are the activities that are allowed for these funds to be used on, and it really does give states a great deal of flexibility in how they use those funds or where they focus their priorities of these funds. But at the same time, it also gives states a great guideline as far as, well, maybe we're not doing this, but we need to spend a little bit more extra funding because of the new bill. Well, this is where we can spend it, or these are where we can go with it. So it really helps states because a lot of them may be thinking about already moving in the direction of some of these, or haven't thought about it in the past, and maybe looking for a way to kind of make sure they're following what's going on. So going through a little bit more about what's out there. So with number one, the first activity was supporting the professional development and training of the child care workforce. So what would that include? It would include scientifically based, developmentally appropriate, and age-appropriate strategies to promote the social, emotional, physical, and cognitive development of children, including special populations. It would be incorporating use of data to guide program improvement. It would include effective behavior management strategies and training, so teaching providers how to effectively manage the behavior of children. Engaging parents and families in culturally and linguistically appropriate ways to expand their knowledge, skills, and capacity to become meaningful partners in supporting their children's positive development. What this means is that families and parents would be greater engaged through this training, or the training would teach providers how to better engage families, especially those from diverse cultural and linguistic backgrounds, to how to help with their child's development, how to be meaningful partners in it, how to really make sure they're doing what they can at home to support their children's development. It could be training on nutritional and physical activity for children, the early neurological development of children, and connecting child care staff members of child care providers with available federal and state financial aid and or other resources that would assist child care staff members in pursuing relevant post-secondary education. What this means is that it would provide, you could use it to provide training on, well, I'm a provider, is there anything out there for me that I can use to further my education that would help make me a more skilled provider? The second allowable activity is improving upon the development or implementation of the early learning and developmental guidelines by providing technical assistance to eligible child care providers that enhances the development of a child, including early childhood development of participating preschool and school-age children, and supports their overall well-being. So that's a lot of verbiage to say that states could use the funds to support the alignment, the implementation, the development, the creation, the expansion, the reform of early learning and developmental guidelines by actually providing technical assistance directly to child care providers in a way that makes sure that they're enhancing the cognitive, physical, social, and emotional development of the children. So I think that's pretty straightforward, which is why I'm moving on to the next one. So I talked about quality rating and improvement systems earlier in the webinar. And there is a good reason for that, because this is one of those sections that, as part of S1086, they gave a little more background on, because as I mentioned, a lot of states are at different stages in it. A lot of states either have it voluntary or are still in development or consistent beta testing for it. So the third allowable activity is developing, implementing, or enhancing a tiered quality rating system for child care providers, which may support and assess quality of providers in the state, build on state licensing standards, be designed to improve the quality of different types of child care providers and services. So what C means is that it would really help ensure that providers from all different backgrounds, from all different areas and income levels would be able to see the ability to improve the quality of care. It describes, first off, the safety of child care facilities. I would promote parents and families' understanding of what the actual system is and the ratings which the program for which their child is enrolled. A QRIS isn't, there's a lot of debate about, what good is a QRIS if families who need to use it the most can't understand what's out there. So this would make sure that, it's simple, it's straightforward, and parents actually understand what the ratings mean and how they got to that point. Additionally, it would provide financial incentives if possible and other supports to expand child care options and help child care providers improve quality. And lastly, accommodate a variety of distinctive approaches to early childhood education and care, but not limited to those practiced in faith-based settings, community-based settings, child center settings, or similar settings that offer a distinctive approach to early childhood development. All this means is that they're not limiting it to traditional child care centers. It would be open to all programs, and QRIS, if they use these funds, would be allowed to do it in a way that kind of encompasses all of the early childhood landscape, which goes back to a lot of what I mentioned earlier regarding, what is the landscape and how does it interact with some of these different programs. The fourth one is about improving the supply and quality of child care programs and services for infants and toddlers through activities, which may include establishing or expanding high-quality community or neighbor-based family and child development centers to serve as resources for quality progression of infant and toddler care. So this would establish or expand existing programs that already exist in communities or neighborhood-based areas or networks to provide resources for families, for providers, around what are the best ways to actually provide quality care to infants and toddlers, which, as many of you know, is a very unique service that providers have a lot of question marks around. It could be used to establish or expand the operation of community or neighborhood-based family child care networks, which we've seen a lot of work in because there are so many infants and toddlers primarily in family child care that the networks really help provide not only best practices and shared services, but also provide a network for those providers and families to communicate with each other to make sure that they're up on the best research out there, make sure they're doing what's right across the community. It could promote and expand child care providers' abilities to provide developmentally appropriate services for infants and toddlers through training and professional development, coaching and technical assistance, and improved coordination with early intervention specialists to provide service for infants and toddlers with disabilities. So it really provides an option for providers to go ahead and get training or technical assistance or coaching around what's out there and what they could be doing and what about special populations for infants and toddlers. It would also be, if applicable, develop infant and toddler components within the state's QRIS. I would improve the ability of parents to understand the consumer information out there about specifically high-quality infant and toddler care. So if there's a lot of good information out there for state already on most programs, but maybe there's not a piece where they specifically get into the infant and toddler component of it, they could add more information or use these funds to add more information around that. And lastly, they could carry out other activities determined by the state to improve the quality of infant and toddler care. So it really allows, once again, that flexibility that we saw earlier. So what are the rest? As you can see, there's a lot of language around those first four. As I mentioned, it was establishing or expanding child care resource control agencies, facilitating compliance with state requirements and state regulations, evaluating and assessing the quality and effectiveness of child care programs and services offered in that state, including how such programs positively impact children. So states could use the money to actually look at outcome-based evaluations and whether or not the care that the state is currently providing or the funds that providers are using are actually impacting children in the most beneficial and efficient way. Additionally, it would support child care providers in the voluntary pursuit of accreditation by a national accrediting body with demonstrated valid and reliable program standards of high quality. So if states wanted to, they could use these quality funds to move providers in their state towards national accreditation. It could also be used to support state or local efforts to develop or adopt high-quality program standards, relating specifically to health, mental health, nutrition, and physical activity and physical development. And lastly, once again, it comes down to other activities determined by the state to improve the quality of child care services provided in the state and for which measurement of outcomes relating to improved provider preparedness, child safety, child well-being, or entry to kindergarten is possible. So that was a lot of information about what's in there. And before I move on to answer questions and open it up, I want to make sure we look at what's there. Once again, states, to use the quality fund, must do no fewer than one of these activities, but are allowed to do other activities as well. So, you know, it's really going to be up, if S1086 does move forward in Congress this year, it's really going to be up to states to determine how they best use those funds, but it does give you more options, more guidance, and additionally, if it does pass and HHS does take responsibility for it, as they will need to, if passed and signed into law, then HHS could add on additional information around what are allowable activities, what are the, you know, around the quality set-aside. They won't be able to change the percentage, but they do have some flexibility in how they determine what activities are allowed, and they could give greater definition into what that means and what the report where states have to describe it looks like. So it really depends, you know, what states are looking for, and although it, you know, definitely defines some greater activities around what states can and should be doing and how much funding they should need to spend and what percentage, it still, you know, at the core gives us, or gives states a very flexible list of options to use. So at this point, we have about 10 to 15 minutes left. I'm going to open it up for questions. Once again, you have a question box in there. We already have a bunch of questions, but please don't hesitate, because if you have a question, it may be asked by somebody else as well, or, you know, maybe there's a couple people who aren't looking to ask it and maybe thinking the same thing. So make sure you get those questions out there to us, and we'll be happy to answer them if we can. First off, and I can go through this later again, both the webinar and slides will be available at usa.childcareaware.org/webinars. So if you go to our homepage, it's just /webinars from there, and you'll be able to find the slides for the first 3 presentations as well as the YouTube video by this upcoming Thursday. So let's get into some of the questions that you guys have. And I think this is one we've probably gotten the most so far, is would the 3% infant toddler set-aside be in addition to the 7 to 9% quality set-asides, or included in the 7 to 9% levels? It would be on top of it. So it would be an aggregate of roughly 10% to 12% from years 2 to 5, from fiscal years 2 to 5 after enactment. So at the end, you'd be looking at about 12% of funds used for quality improvement activities. And what's important to mention about that is, as I mentioned, the national average for states is around 12%, and you see most states hovering either above it or right in that, you know, 8 to 12% range already. So it's not that they have far to go, but they may need to look at how they're using those funds. So this is another great question. Does allowable activities also include the parent education work with parents through the CCR&R system so that they understand the quality rating and improvement system? The simple answer is yes, that would be considered an allowable activity, and it would fit into a few of them that are actually listed as there, but it would be up to your state to decide whether or not that's how they determine the use of funds. So states would have the flexibility to determine, well, that certainly looks like it fits in there, and if that's their interpretation in the state, then they could definitely use their funds for parent engagement and, you know, assisting the consumer education piece. It's definitely something that they wanted to make sure when they were drafting this bill and debating it, that there was a lot of discussion around well, parental choice is a major tenet of this bill. How do we make sure that families who are getting these funds actually understand what options are out there for them, and what those options actually look like? So it would definitely be something that could very well fit into that kind of definition. Let's see. Like I said, we have quite a few questions, so I want to make sure we can get through them. This is a good one, and a little bit about logistics. Has the Department of Health and Human Services always been in charge of providing guidelines? So a little bit about bill passage, enactment, and implementation. So I think this is something, although in our 4th webinar series, we're going to talk a lot about the appropriations piece as well as the timeline for everything. Based on, certain assumptions. Obviously, we can't say entirely for sure yet that the bill is moving forward and that it will be enacted. And until then, all we are able to do is kind of give a general timeline. But in the passage of a bill by Congress and the enactment of that bill from bill to law with the President's signature, what would then happen is a bill goes to the relative agency. So if it's a bill about the workforce, it would usually go to the Department of Labor. Since this bill falls under the Department of Health and Human Services jurisdiction, they would take it on at the federal level and write guidelines for implementation. Just they can, provide guidance around, well, this is how, we believe this to be interpreted. This is how states should be looking to do this. Or they can even add in some additional pieces which go above and beyond what they have stated in the bill, just to provide, a better idea of what states can use those funds or what states can do generally. So whenever it's a relevant bill, especially this program, it does fall to the Department of Health and Human Services to implement. Well, this is a great one as well. If I was asked if I could talk a little bit about the appropriations process and the timing, and whether or not what the funding levels will be, when will we know it. This is a question that I think we get multiple times in every presentation, and I'd be disappointed if we didn't get it, because it really is something that's important to the program moving forward. Is that, so currently the last bill, so the bill authorized funding level, authorization levels for increases over the next 5 years from fiscal year 2015 through fiscal year 2020. And at fiscal year 2015, it authorized a flat level to fiscal year 2014. But those are just baseline authorization numbers that kind of present an area where appropriators can't go below, but there's nothing stopping them from going above them. So even if they have to cut certain places within the federal budget, which is always a possibility when the appropriations process, they cannot go lower than what the authorized funds are. And a little bit of background before I move on to what the process is now and what we're looking at. Funding authorization for CCDBG actually expired in 2002 and actually has been without authorization for funding since then, and just has been appropriated as a direct result of the of Congress seeing value in the program and the need to continually increase funding even above what the authorized levels were back in 1996 through 2002. So what that means is that it is very possible that these are nothing more than the bare minimum baseline levels for funding that's there. So what does that mean for actual funding levels and what's going on in the next few years? It's a lot of question marks right now, because what happened was Congress put into place what was called a continuing resolution to fund the government through December 12th, which basically funds all programs at levels and may have one or two pieces which provide extra funding or less funding for certain programs, but generally funds programs where they were at for the previous fiscal year. It's a way of kind of kicking the can down the road to ensure that the government's at least going to function in the short term and we don't get another government shutdown like we had last year. So what Congress now needs to do is when they come back, they need to either agree on an omnibus spending bill, which covers all federal spending for all government agencies and programs, or they need to agree on another continuing resolution, which would kick the can to the next Congress. So trying to figure out where the levels will be, we know currently the chair of the Appropriations Committee, Senator Barbara Mikulski, and the chair of the subcommittee in the Senate, Senator Tom Harkin, are very dedicated advocates, and they were sponsors for this bill when it was originally introduced. If there is change, or we do know Senator Harkin is retiring, so he won't be there next Congress, so it's really, a lot of it's currently in flux around, well, what's going on, and it's kind of a wait-and-see approach. So hopefully we'll know more in the next few weeks as Congress returns and some of the negotiations kind of fire up again, as well as hopefully we believe that with some of the proposals that have been out there already, that there will be, at least a desire by Congress to increase it above where the authorizations levels are. So I hope that answers that question. Let's see. Like I said, we got quite a few questions, but please feel free to go through. So this is a great one, and it's kind of building upon one of the other questions. Please outline the process that will take place after the bill is signed by the President. So I mentioned that the President signs the bill. It goes to the Department of Health and Human Services to put out guidelines. Well, then what? And I think that's something that's definitely a little bit in flux, and like a lot of this, and you'll hear me say this, really depend on how quickly it is passed to sign into law, and HHS, the Department of Health and Human Services, can turn around something to provide guidance to states. So, and I will recommend, if this is something you're more interested in, our next webinar will focus a lot on implementation timeline, and we'll go into kind of some of the pieces that are out there. The majority of pieces that need to be in place for the first full fiscal year, or the earliest after enactment, are some of the stuff that's really up to the Department of Health and Human Services. But that doesn't mean from the time they release the guidance, if it passes, to the time that these requirements take place, that states shouldn't be moving. States will need to be moving very soon, but should be cautious because the bill hasn't passed yet and the guidelines could change. So it's really, once again, another piece of it that's in flux based on the timing of everything. So I know that wasn't exactly what probably the answer you were looking for, but hopefully that helps kind of explain what's going on. This is another good one. I know a couple of you guys have had this question. Currently, some states fund their basic child care licensing program from CCDBG funds. Will this be allowable under S1086? So what will be allowable is, through our interpretation, is allowing the funds to be used for state regulations and licensing requirements that go above what the federal wants is. So they wouldn't necessarily be able to use it on the federal pieces that are changing, but they would be able to use it on, if there's a piece of their program or piece of their licensing requirements that go above and beyond what's currently out there or what could be out there, then they could use it to fund that. So I hope that kind of makes sense around, it's not a complete picture, but it's a little bit of what could be done. Let's see what other questions we have out there. So this is a great one. Who is going to conduct fire, health, and safety inspections? Seem like state, local, fire, and health are needed, not the federal government. So this is a question we've gotten because this is an interesting piece that was added in the House amended version that passed the House. And what it really comes down to is states will have the flexibility to determine who does these state fire, health, and safety inspections. They'll determine whether or not it's a state inspector who does it, whether or not it's the local fire department, or whether or not it's whoever's in the state. But it definitely will not be somebody from the federal government coming and checking in. It'll be somebody from the state, most likely, providing that inspection around some very, very basic standards. I think we have time for maybe one or two more questions. Let me see. Like I said, we have a bunch of great ones, so I want to make sure I try and get to as many as possible. Before I answer the last question, I want to say if you have additional questions, please feel free to reach out to Michelle and I. We're very happy to help on this. If your question didn't get answered, or you're reading back through the slides or see something, please feel free to reach out. We're definitely open to having conversations about this and helping clarify or provide better understanding of what's out there. So the last question is regarding eligibility being redetermined no frequent than annually. Would this apply to protective service clients or clients that the state uses referrals to establish eligibility periods that are less than 12 months? So I don't think my answer is probably going to be too much of a surprise, but it really will depend on the state. The state will have some flexibility. It typically should apply to, I believe the intent was to apply to all families who receive that, but I do believe there will be some flexibility. We're kind of waiting. This will be one part where HHS will probably need to provide some guidance around when they put out their, kind of guidelines for implementation. So we're curious about that as well. And at this point, I appreciate all of the great questions we had. I would like to encourage you, if you have questions about funding appropriations and timeline for implementation, which I think a lot of people do, please feel free to register for our next webinar. We greatly appreciate having you on this one, and really hope you guys have enjoyed it and gotten a lot out of it. And here's our contact information if you have any additional questions. Thank you, and have a great rest of your election day.